Thank you, Governor. Good afternoon, everyone. Happy Friday. To get started with the data, we have 45 new cases to report today. There are 61 people hospitalized, and 4 people are in the ICU across the state. 5 people are on a ventilator across the state. This is one of the rare times that we're able to explain that there are some hospitals in Rhode Island that have special non-ICU units that do have ventilators. And that's why you've heard the number on a ventilator compared to the number in an intensive care unit. Unfortunately, we have 2 new COVID-19 associated fatalities to report. One of these people was in their 50s, and one of these people was in their 70s. We continue to extend our condolences to the families impacted during this time. Shifting gears, as I indicated on Wednesday, many nursing homes and assisted living facilities have reopened for visitors. Most have opened and are scheduling short, outdoor, socially distanced visits for the loved ones of residents. There is a small number of facilities that took another week or so to get ready, primarily because they have just had a new case or have just finished addressing a cluster of cases and want to take the time to address that and then open to visitors in the scheduled format that we have required. We had a call this morning with facility leadership to get their feedback on the process and how it's going. We continue to communicate regularly with such leadership as well as the nursing home and assisted living facilities. Generally, things have been going well. People are adjusting to new processes that are in place. And it allows me to take the opportunity to remind that you need to keep your mask on for an entire visit. The cloth-based covering makes a difference, and although it's tempting to take off your mask when you haven't seen your loved one for so long, it is a requirement that people continue to wear their mask throughout the entire visit. I know I said this on Wednesday, but I also want to repeat how appreciative we are of the staff at these facilities and the administrators for their hard work and partnership. This will continue to be an important path forward. I also want to thank residents and their families for their patience and their partnership as we've worked together to balance the need to keep people safe and the need to see your loved ones. This also has not been easy, and so we appreciate that together. Separately, I want to take a moment to discuss testing and data, because that's an issue that's been in the news lately. It's important to start with the understanding that states are reporting testing data in different ways. That discrepancy makes it challenging to be able to report a comparison that's accurate across states. Many states are reporting the number of tests run. Some states are reporting the number of people tested. In Rhode Island, knowing that we strive continually to maintain the transparency to data, to continue to make sure that it is available, that it's clean, it's accurate, and it's up to date for people, earlier at the beginning of this week, we updated our numbers so that people could have a clearer picture and started reporting both ways, the number of people tested as well as the number of tests run. Rhode Island, like many other states, often frames our total number of tests in connection to our overall population. So how is the total number of tests equivalent to the percent of the population? This is a common practice to help people make comparisons between states more easily. That said, it's helpful to also talk about what our focus is when we're looking at tests being done. We're not trying to reach an arbitrary benchmark. Our goal is not to test every single person in the population once. Our goal is to continue to be strategic in our approach to testing. We have shared that throughout this journey, and that's what has kept us at the forefront of this response from a testing standpoint. We have three facets to our testing strategy in Rhode Island. Focusing on testing people who have symptoms, getting them tested quickly, continue to work on making sure they get the results and we can respond, and while waiting for the results, they know what to do. We are also using testing as a way to respond rapidly to outbreaks so that we can quickly get our arms wrapped around that outbreak and stop secondary and further transmission from occurring. And we are testing higher risk populations. That's our early warning system of testing people who may not have symptoms, but who work in high contact professions, such as hairstylists, restaurant workers, and first responders, as well as people who live in communities with higher rates of illness. That's so that we can continue to scan the landscape for where there may be clusters of cases that are occurring that people may not be aware of. We have a strategic approach because who we test matters. If we were to test in an arbitrary way, our number of individual people tested would probably be very high. But that would be of much less value to us in our work to prevent the spread of disease. Our approach is to test and retest in a deliberate, calculated way. That means cyclical testing in nursing homes and cyclically testing nursing home workers. We are leading the country in the number of cycles of testing we have done and offered across our state to all nursing homes and advancing that into other congregate settings. It also means testing to prevent outbreaks by doing more than one round of testing when a large exposure has occurred, so that we can be thorough and comprehensive in ensuring that there is no secondary transmission. That has been effective. And we are regularly testing people who we know are coming into contact with large numbers of other people because of their job or because of their exposure. We want that early warning system of testing to lead to multiple repeat tests so that we can help understand the landscape of disease and stay in front of it. Retesting people strategically to prevent outbreaks is the core of our approach to testing, and it's important for people to understand that when we can proudly say the number of tests that have been done are equivalent to this large number of people being tested, knowing that we have been pinpointed and strategic in how we've applied those tests. National rankings have some value. For example, we are using a national ranking to inform our quarantine and testing requirements for travelers. It's an easy reference to have available and easy to understand. However, the testing strategy behind any state's numbers is also very important. The effectiveness or ineffectiveness of that strategy becomes apparent when you look at that state's number of new cases. And given what we are dealing with in Rhode Island, unfortunately compared to what other states are dealing with, we have indication that our testing strategy is effective at decreasing the number of new cases. So in Rhode Island, we are sticking to our strategy because it is working. We've seen a steady decline in new cases since April, when we were seeing 300 and 400 new cases a day. And as the governor often says, we are not out of the woods by any means, but we are moving in a good direction. So we'll continue to do what it takes to help us do that.